The lower blood pressure or the diastolic blood pressure is dangerous. There are 7 very dangerous reasons for the rise in diastolic blood pressure that everybody should know in the age of 30 to 50. At the end of the video, we'll also discuss how to reduce the risk of the rise in diastolic blood pressure. So the 7 dangerous reasons of blood pressure. Number 1 is the age risk. The age is surprising that the age between 30 to 50 is at risk of diastolic blood pressure. The older the age, there is a chance of increase in blood pressure because of there is a stiffening of the vessels. The vessels tend to get more stiff, pipe-like, they are not really soft. So that's a problem. But when you are too old, the stiffening of the larger vessels leads to a rise in the systolic or the upper blood pressure, and the lower blood pressure tends to go down. But in the middle age, there is an increased risk of diastolic blood pressure. The second risk factor is obesity or the increased weight. If you are having a lot of weight, there will be an extra fat, and that will lead to inflammation of the vessel's wall. If the vessel wall is inflamed, it's just like going on a bumpy road or a road that is having just a single lane for a traffic that needs a 6-lane traffic. So there will be an extra pressure within the body, and this will lead to a rise in diastolic blood pressure, and that can give a rise up to 10 millimeter of mercury even. The most important reason in my opinion is the stress, and the stress is causing a lot of diastolic blood pressure around the world, and it is typically targeting the patients who are in the age of 30 to 50 years old. Usually they are the ones who are the successful executive business owners. They are almost at the pinnacle of their career. They are working really hard. They are struggling. They are working against time almost sometimes. So most of the patients that I see are facing some kind of time limit. They have to go for a certain task before a certain time, and they are under a lot of stress. So just like bankers, the executives, the chief executive officers, so these are the ones who face maximum stress in a job environment. It's the psychological stress because they are the responsible persons. So stress is something that you need to keep in mind, and we'll discuss how to curtail that. Along with that, the next 2 reasons are related to some disease. If you are having a kidney disease, there is a good chance that you will be having a rise in diastolic blood pressure first. And there are so many reasons for that. One of the obvious reasons is there is a blockage of sodium being excreted out of the body. So the more sodium is in the body, there will be a rise of blood pressure. Along with, there is a reduced excretion of the urine. So there will be an extra fluid within the vessels. So the extra fluid and the extra sodium will lead to a rise in blood pressure. The next thing is diabetes mellitus. Diabetes mellitus has a multifactorial effect on blood pressure, but the diastolic blood pressure is also a risk factor. And the reason for that is that during diabetes mellitus, there is a dysregulation of the lipid system. There is a rise in cholesterol, there is a rise in LDL, triglycerides, and all these lipid products, they are going to be deposited within the vessels, and that leads to a rise in blood pressure. Along with that, there is an increased tendency to limit sodium within the body. The 6th reason is the lack of sleep. The people don't get sleep that much. Usually a 6-hour sleep is a good night's sleep. I don't recommend anything less than 5 hours per night, and usually a night sleep is better than a daytime sleep, and that is obvious for so many reasons. It is proven by so many studies too. So a lack of sleep is a risk factor, but along with that, I may add another thing is that if you are having a lot of snoring in your sleep, this may be a sign that you may be having a condition called obstructive sleep apnea, in which there is a lack of oxygen when you are sleeping, and it is usually associated with an extra weight, an overweight individual, and obesity. But it's not necessary for somebody to have an obstructive sleep apnea called OSA to be having an overweight body. You can have a normal body. Only sleep studies will let you know that you are suffering from it or not. And this is usually a concealed cause of blood pressure. And the 7th thing is the diet. Our diet in the modern era is full of sodium. We are taking more than 3 grams of sodium in a day in a Western diet, and this is leading to such a steep rise in blood pressure patients. Along with that, we are taking a lot of fast food, fried foods, and we are not taking enough vegetables and not taking enough fruits either. So if you want to reduce your blood pressure, you need to change your diet. Reduce salt, take more of vegetables, take more of fruits, take good night's sleep, control your diabetes. If you are having a kidney dysfunction, it needs to be controlled. You need to talk to your physician. The stress needs to be curtailed, and the best way to do that is just to be mindful of the fact what your mind is going through. If you are keeping a watch in your thought process, you will be able to control most of the nagging kind of thought processes that are going in your mind. So mindfulness and meditation, as I alluded to in my previous videos, is a wonderful way to curtail blood pressure and stress. You can just give 10 minutes of solitude and give it to yourself, and focus meditation will help to curtail and control your blood pressure. You may even be off medicine. And the first two things, obesity, you need to reduce your weight, that's an obvious thing. And finally, age is something that is not in your control, but when you are at the pinnacle of your career and you are going through the stress and the success, be cognizant of the fact is that you are not running a 100-meter dash. Life is a long marathon. Go for the long term. Focus on your health. Give priority to your health. Everything else comes to the second value or the second priority. I hope these videos are going to add some value into your life. Thank you so much for tuning in.